Hello, students. I'm Dr. Ying Hui Su. I'm here to introduce the Department of Operative Dentistry in our hospital. So when we talking about operative dentistry, usually we manage the caries, and of course we have the G.V. Blake classification of cavity 1 to cavity 6, 1, 2, 3, 4, 5, 6. This all kind of caries, or we call cavity in tooth, which is we operative dentistry will dealing with, and we using the different kind of material. That's like this one, we use the composite resin to fill the class 2 cavity, and in this picture we use amalgam to restore posterior tooth, and we have porcelain veneer for anterior aesthetic zone to restore the discoloration of the tooth, and we use ceramics also to do the inlay for posterior tooth, and also we have metal or casting gold restoration for longevity for posterior tooth restoration. So now I'm going to talk about some of my cases to introduce the daily work of our operative dentistry department. The first one is the black triangle closure in anterior teeth. Like this one, patient have anterior black triangle like this, and patient feel it's not very aesthetic. So we use the composite resin, and we use it under rubber dent isolation to fill the gap of the anterior black triangle area like here. And as you can see, is almost you almost cannot tell apart the difference between the composite resin and the anterior tooth. So when you choose the right composite resin, you cannot find the gap or any difference between the tooth and the composite resin. And also we dealing with the pack shed lateral incisors like this one. The patient 1-2 and the 2-2, the tooth 1-2 and the 2-2 is pack shed lateral incisors, which means it's smaller than regular lateral incisors. So in these cases, we work with the orthodontic department. They give the orthodontic treatment to move to align the tooth, and after the orthodontic department decide the position of the lateral incisor, we use composite resin to restore the lateral incisor back to the normal shape. So this is the outcome. And also when we do operative dentistry to treat the caries, we usually maybe happens that the pulp will expose when we remove the caries. So this is before the caries all removed, and this is the after the caries is all removed, and we can find that the pulp tissue is exposed. So we will use the bioceramic material to tap on this exposure pulp, and we restore this tooth with composite resin, which this vital pulp therapy can avoid an unnecessary endodontic treatment. And in posterior tooth, we have large decay. If the decay is maybe more than 1/2 volume of these tooth, it's a big decay. So we will prepare the tooth to some kind of cavity, and we impression and use the ceramic restoration, which is called bond porcelain restoration. We can shortcode it by BPR, and we use this kind of BPR to restore the posterior tooth in very good shape and good condition. And also we can use the gold material to restore the posterior tooth, which it seems to be not that aesthetic, but the gold restoration is the most longevity you can get in posterior tooth. It's a good material, but it's not very aesthetic in anterior tooth. And also, we will treat the root caries, which caused by the horizontal impacted thermolar. When horizontal thermolar is impacted here, and it will cause the foot infection right here. So patient cannot clean this impact tooth with himself. So the caries occur. So in our department, we will treat the posterior root caries here and fill it with composite resin, which this case is very difficult. And this one is proximal resin infiltration treatment, which means the caries lesion is very, very small, which we call it non-cavitated caries lesion here. And we will use acid to age the tooth and also the caries lesion. And after the agent of acid, the caries lesion become white, and the caries lesion will decalcify. And after decalcified, we use the resin infiltration, which is very, very flowable resin here, and to infiltrate the structure of tooth and the caries lesion, to use the resin to infiltrate the caries lesion here, and to let this structure be more strong than before, which is very, very minimal invasive treatment. We call it proximal resin infiltration treatment. And also, of course, we have the posterior composite resin restoration. This is the after the caries lesion here, and this one is the after caries composite resin treatment, which you almost cannot tell the difference between the tooth and the composite resin. Also, we have different kind of root caries treatment, which this one is almost caused by the implant between these tooth, and the foot impaction here, so cause the caries here, and we restore with composite resin. And in our department, we also treat some different kind of cases, which this is amelogenesis imperfecta, which you can see the tooth enamel is not very strong and weak, and the shape of this amelogenesis imperfecta patient, the tooth, the shape is very different. So the structure is bad. So it also causes caries problem. So, and we also restore this tooth with composite resin. And additionally, we do a hands-on course for our resident and intern. Of course, we have different kind of hands-on course, This one is anterior tooth. We have our resident and intern to prepare the tooth model, which are under the microscope. And after that, we scan the tooth preparation and to do the digital hands-on course, which after we prep the anterior veneer, we scan the tooth, and we have the student to design their veneer on computer software by themselves. And after that, we use the CAD/CAM machine to manufacture the veneer, which is student that they design and manufacture their own. And after that, we have the student to cementation the veneer, which they prepare. This is the student's work. This is the old photo of the tooth preparation of veneer. In the middle one, this is the veneer, which is digital designed by students themselves. And this is the after cementation photo. And we have different kind of resin restoration course. This one is the dark triangle, black triangle filling anterior tooth hands-on course. We also have a deep learning. We have a lot of learning about the dental bonding system, which we call. We have all these different kind of bonding system here to talking about what's the difference between this. And we also have the anterior composite resin restoration course like here. Thank you for your listening. This is all the course and the clinical work which we will do in operative dentistry department. Thank you.